Okay, good afternoon, everybody. Good afternoon. All right, first and foremost, can you hear me okay? All right, if you can't, if I start to slip, keep me accountable and give me a thumbs up, and I'll crank up my volume, okay? It's so nice to be here. I look out in the crowd and I see friendly faces, and I see friends to be. So thank you for those of you who live here at Peterson Meadows for coming out, and thank you for those of you who are curious. It's honestly one of the best things you can do for your brain is to be curious. So check that one off your list. Way to go. All right, so my name is Wesley Willows. Right now, I am the Corporate Director of Brain Health and Wellbeing for our entire organization. When I started here in November of 2022, I started as the Assistant Director of Memory Care. And previous to that, I was an occupational therapist. So I've worked with kiddos in pediatrics. I've worked with folks who have had a stroke. I've done a little bit of everything, and I found that caring for those with dementia was my sweet spot. That was my passion. And the brain is kind of like a mini universe. And I'm a big science fan, big space fan. And when I think about the brain, I think there's so much to be discovered. So I'm glad that you're all here today. Thank you for taking this journey with me. We are going to dive into brain health and well-being and figure out how does that pertain to me, right? Why should I need to know this? I'm very lucky to have Aileen with me here today. You will hear from her throughout the presentation. She represents our local chapter for the Alzheimer's Association. A lot of good research happening. We are strong supporters of that. Every year we do a walk. How many of you have done the Walk to End Alzheimer's? All right, very good. We're going to see all hands up next year, right? All right, so let's go ahead and get started. So first and foremost, what is brain health? Can you all see the screen okay? Yeah, I'm going to scoot back. Hold on. You're welcome. Is that better? All right, so what is brain health? Now, like I said, the brain is our supercomputer. It controls everything that we do, from thinking to moving to the jobs that we do, etc. According to the World Health Organization, brain health is the functioning across cognitive, social emotional, behavioral, sensory, and motor domains, right? So if you look at our brain over here, see all those highlighted sections? We actually have 8 different domains of cognition. Memory is just one of those. A lot of times when we think about brain health, we focus on what? Memory, right? There's so much more to that. There's thinking, there's movement, processing. So one of the biggest takeaways I want you all to pay attention to is this right down here. Now, when we talk about things like heart health, what do we think about? Anybody, shout it out. When you think heart health, what do you do for that? Exercise, diet, anything else? Okay, those are 2 out of 3. Yes. So when we talk about heart health, you guys are already well versed in that. We've been conditioned to pay attention to our heart, right? It keeps us going. It doesn't stop, and our brains don't either. So when you leave here today, just like you rattled off 3 things for heart health, diet, exercise, and stress reduction, you're going to leave here rattling off the 3 most important things for brain health. That is also, whoops, it's a guessing game. There we go. Okay, so just like diet, exercise, and stress pertain to heart health, for brain health, remember these 3 things. The Mediterranean diet, we've got exercise, so that's just a no-brainer, if you will, and socializing. Those are the top 3 things you can do for your brain. So look at us here right now. We're all socializing already, so you can check that off your list for today for brain health. Have you all heard of the Mediterranean diet? Yeah. Yeah? Okay, tell me a little bit about it. What do you know?
It's plant-based.
Plant-based. Fish. What else? Nuts. Grains.
And a lot of wine.
And a lot of wine. That's the best part, right? Well, first of all, you're hired. She's our new expert in the Mediterranean diet, but she's absolutely right. They have found that in the Mediterranean, diets that are high in those healthy fats and oils that come from fish and olives. That all does something really magical for the brain. It's something called the blue zone. Has anyone heard of the blue zones? There are some special pockets in the world. In the Mediterranean, there's one. There's obviously a couple in Japan as well. And what the blue zone is where people thrive. People are living long, they're living well, their health is great, their mobility is great, and it has to do with where they live, the conditions of their environment, socializing, and their diet. Okay, so tell me 3 things about brain health again. What are they? And so, awesome. You guys are all experts already. Okay. So now we know a little bit about brain health. We're skimming the surface. So why does it matter to us? Okay. Well, you're all here for some reason. You all have already identified that this does matter to you. So the fact that this room is filled is a testament to the fact that brain health does in fact matter. So we want to maintain our independence, correct? We want to do what we want to do for as long as we can do it. And what's going to help us get there? A healthy brain, right? We want to preserve our cognition. So remember I talked about those 8 domains? Memory is one of them, but movement as well. Movement comes from the back part of the brain called the cerebellum. That's obviously an important part for us. We don't think about walking, but we do it. It's pretty magical, huh? Also, why brain health matters, this is the biggest piece. So when we talk through this slide, the biggest takeaway is being proactive. Okay, it's never too early and it's never too late to start. But you being here right now, I want you all to see this as the starting line. Okay? You are starting your journey in improved brain health right here, right today. Okay? One of the other big reasons this matters is making sure you have a supportive environment. Sometimes when people move into our organization, it's because home is no longer working for them, right? Maybe they need more people around them to help them throughout their day, more socializing, more assistance. But it's really up to us to assess our environment. Is my home doing what it needs to be to support me? Okay, is my social supportive environment helping me? Okay. So we're probably wondering, well, how has my brain changed? I'm now at a certain point in my life, so what does that mean for my brain health? Should I be doing the same things for my brain as I would if I was 20? So how the brain changes as we age. There's something called normal brain aging and abnormal brain aging. How many of you forget where you put your keys? How many of you forget where you put your coffee cup? How many of you do that multiple times a day? I'm going to tell you all right now that's normal. So I'm going to give you all a free pass on that right here, right now. Now what's abnormal is forgetting how to get dressed. Okay? Taking additional pauses in things like cooking a meal. Let's say you have a recipe for banana bread from your great-great-grandmother from Poland. You know it by heart. You set the butter out 2 days early because you know it has to be soft. Not microwaved and not warmed in your hands, right? So when you start to forget big important things like that are routine, that impact your everyday, that impact your self-care, that's when there's a little red flag that's waving, okay? Let's say you go to the Aldi on East State every single day. Maybe not every single day. How about every Sunday, right? That's your grocery day. And you could get there with your eyes closed. If you start to forget how to get there or how to get back, that may be a little red flag, okay? Does that kind of make a little bit more sense as far as what's normal and what's not so normal? Okay. The other big thing that I get is people will come to me and say, I'm starting to forget words. Should I be worried? Well, if you remember them a couple minutes later or a couple hours later, let's say you have a favorite restaurant and you're talking to your best friend, let's go to Shoot, what was the name of that place again? How many of you do that? Yeah, right? It's so frustrating. And I'll tell you, the moment you get frustrated about it, that information gets further away. So first and foremost, take a deep breath and recognize that that's normal. Now, if that information, let's say we're having a conversation and I can't recall my family members' names or your name, right? Or I'm misplacing a lot of words in one sentence, that's another one of those little red flags, okay? So word finding may become more difficult and frustrating, but it's not always abnormal. Make sense so far? Okay. Oh, one more thing I want to mention. Okay, so that's a little bit about how our brain changes. There's this fun, fancy word up here. I know it's kind of blurry. Neuroplasticity. Has anyone heard of that before? Yeah, okay. So fun fact, our brains are plastic, not like Tupperware plastic. They're plastic in the fact that they can flex. Right? Right now our brains are like a road map. Now let's say you travel the same roads every single day. Your brain's going to be a pretty structured grid. But let's say you maybe walk and you take the back roads one day. That's improving your neuroplasticity. You're now creating new and improved neural pathways within your brain. So now you have two methods to get to the same information. Make sense? Okay, we want neuroplasticity. And guess what? Your brain is built to be plastic. So again, it doesn't matter how old you are, when you start, when you don't start. Your brain is plastic and ready and waiting for you to create more pathways. Okay. All right, so this is where Aileen comes in. So I'm going to pass the baton on briefly to her. Okay? There you go.
Thank you so much, Leslie. And just to kind of go back to that neuroplasticity conversation, we were just talking about, doing brain games and word games and things like that. And I was mentioning that one of the neurologists that I do presentations with fairly often, he oftentimes gets asked when we're out in the community, if I do crossword puzzles every day, will that, make my brain okay for the rest of my life? And so he will say, you get really good at crossword puzzles. Yeah. And so when we talk about that neuroplasticity, it's all about figuring out new things. So maybe listen to different kinds of music or learn a new hobby and things like that. So those are kind of some things that kind of go along with that neuroplasticity. So I just want to mention that. So again, my name is Aileen from the Alzheimer's Association, and so happy to be here today. And one of the things that we're going to talk about is our facts and figures report. So every year we do a facts and figures report, and it comes from research that's being done all throughout the year. And what came out in our 2025 facts and figures report was that there are now 7.2 million Americans that are living with Alzheimer's. And let me kind of throw in a little thing here too. How many of you know the difference between dementia and Alzheimer's? Those two words are kind of used interchangeably very often in the news and everything else. So what we can kind of think of it as is that dementia is the overall umbrella term for many different types of dementias. And these are changes in our brain that affect thinking and behavior and memory, and to the point where it's affecting our daily routines. So if you think about that umbrella of dementia, Alzheimer's is one type of dementia. So it's in the list of different types of dementias. So again, that's 7.2 million Americans living with Alzheimer's. We have 1 in 3 older adults will die with Alzheimer's or another dementia. So it's not really, affecting 1 in 3 people. It does kill more people than breast cancer and prostate cancer combined. So that's a really staggering statistic that many of us are not aware of. Nearly 12 million Americans are providing unpaid care for people with Alzheimer's and other dementias. So family caregivers, children of someone who has the disease, or even a friend, a neighbor. So 12 million people, that's a lot. So, but when we look at people who want to know about treatments and want to know more about the disease, really it's up to 4 in 5 people are now wanting to know more about it. Alzheimer's went many, many years with a terrible stigma, and we're really still fighting that stigma of people just not wanting to talk about it. But think about years ago when nobody wanted to talk about cancer. Now everybody talks about it. Everybody shares different experiences. We want people out there to be sharing their experiences because we don't want anyone to feel alone. And if it's affecting, 1 in 3 people, it's likely that it's affecting your friend or your neighbor. So these are some interesting statistics, and we're always doing more studies as the years go by. So these obviously will change with our baby boomers. It's people are living longer. We're going to see an increase in people who are experiencing the disease. So I think I'm going to end it.
Mm-hmm. Okay, thank you. I'll take that.
All right. So before I move on, I just want to put out a couple more numbers for you. I was looking at some research, and back in 2002, across the United States, they identified about 3.5 million people living with Alzheimer's. In 2023, that was closer to 6.7 million. And they're anticipating by 2030 that to be 12.7 million. So you see how that jumps exponentially, even just in the next 5 to 7 years. So part of my job here is to make sure our organization is prepared to support folks, not only with that diagnosis, but before that diagnosis even has to be made, how can we support our brains to better prevent that? So pretty staggering. That's what really reinforces what I do every day. All right, so we talked about brain health, but now what about well-being? What exactly does that mean to live well? So here we have a lovely little wheel. Could be some type of wheel of fortune, right? The way that you look at it. So just like our brain, how we have 8 domains of cognition, we also have domains of well-being. So again, social well-being is a big one. Okay? If you have a strong sense of friendships, relationships, family structures, then your well-being bucket for social well-being is pretty full. So what we look for our residents is developing programs and services that allow you to assess, okay, I feel really good in my social well-being, but my intellectual well-being, I feel like I could really fill that bucket a little bit more. So that's what you all are doing right here, right now. You're filling your intellectual well-being bucket by learning something new, okay? And again, that helps with that neuroplasticity. So you're checking 2 things off at one time. So when you look at this wheel, we have intellectual, we have spiritual, occupational, that could be volunteering, retirement, if you're still working, social, financial, emotional, physical, and environmental. Now, when you think of environmental well-being, it's not necessarily just nature, but it's this room right here and right now. Okay, how do we feel in this room? How does it support our sense of security and stability? How does it give us cues as far as what we're supposed to do? When you walked in here, did you sense that something was going to happen? Did it make sense? Okay. So for a lot of our residents with dementia, especially in skilled nursing, a lot of times skilled nursing feels like what? A hospital, right? That's why a lot of our residents say, I want to go home, because the environment does not give them the cues like their home once did. So that's one of our big goals, is to make sure no matter where our residents are, we want them to identify that with home and how can we help. Okay, so when you look at this, I want you just to take a quick second and assess. You don't have to say it out loud, but just assess. which of these buckets are full and which of these buckets do I need to work on? Okay, where is my well-being right here, right now? We did develop a dimensions of well-being for Wesley Willows. If you're interested in that, please email me or Melissa. We can send that over to you. For our current residents, how many of you use WellZesta? Awesome. So for those of you who don't know what WellZesta is, that is our engagement app for our organization. We put all of our programs up there, and the programs that we list are tied to one of these dimensions of well-being. So you can track how you're filling your bucket with all the things that you sign up for. Okay? All right, so we're going to dispel some myths. Kind of like Aileen said, there's been a lot of stigma around brain health, around Alzheimer's. I know in January, when I switched over to this role and we developed this department, brain health and well-being, I had a couple residents and family members reach out and say, what do you mean brain health? What are you trying to say? Are you saying that I need this? Right? And again, that's that kind of stigma that has been existing for quite a while that we want to start normalizing. Just like we talk about heart health and stomach health, all those other systems, we need to also talk and normalize brain health. So memory loss misconceptions. Just because we're aging doesn't mean it's normal to lose our memory. Okay, just because we're aging, it doesn't mean that we're going to get Alzheimer's or dementia. Okay, so there is a huge myth out there that dementia is kind of a given with age, and it's not. And that's why we're right here today to talk to you about how can we start preventing this and supporting this so that's not ultimately our future. Okay. So preventing cognitive decline, a lot of our lifestyle choices can improve our cognitive health. So again, think of it like a wheel. If we're exercising right, eating right, socializing, learning new things, that's all going to better improve our cognitive health and help us become more resilient if we were stagnant or withdrawn or eating a lot of fast food, right?
So Alzheimer's is the most common type, but you've kind of seen some of these other ones. Vascular dementia can sometimes be related to stroke. Lewy body, we've heard of some of the celebrities that have that. And sometimes people can actually have a mixed dementia, which is different types of dementias combined. So when we talk about cognitive decline, this refers to changes in our memory, our thinking, and our behaviors, and our reasoning that become worse over time. So basically, we want to always talk about the fact that dementia is not a normal part of aging. As Leslie mentioned, it's kind of, we're not always on that path. So this is, a special different type of brain change that can happen. So dementia is not a single disease. Again, it's that umbrella term, just like heart disease, where there's many different types of heart disease. And it covers a wide range of conditions. It's different for every person. That's the really tough part about dementia and Alzheimer's, is that everyone experiences it in a different way. So it's going to affect our language possibly. I used to work for hospice, and one of the things that happened, a nurse came to me and she said, one of my patients has reverted back to speaking their native language of German. And so she's talking and we don't understand her, says the same comment every night, we don't know what it is. I ended up bringing in some volunteers from Northern Illinois University, and it turns out she was saying a prayer in German every night. So they worked with the staff, taught the staff the prayer. Those are interesting things that happen, but what a struggle nonetheless for the caregivers especially. So we want to talk about, how that can affect both the person living with the disease, the families, the caregivers, and how we can work through that and how we can support you. So again, Alzheimer's is the most common type of dementia, and what we always talk about too is that sometimes people will be diagnosed with what's called mild cognitive impairment, and that's sort of scary. That's a scary diagnosis. And we want to make sure that you talk to your doctor because that does not always lead to dementia. So that's kind of an interesting thing to keep in mind too when you're working with different diagnoses. And I think it's going back to
Thank you, Eileen. All right, we touched on this a little bit as far as those early signs of cognitive decline. Remember that little red flag that might be waving? So a couple of things that you can kind of keep tabs on during your days. Common early indicators, things like memory lapses. Again, that means forgetting how to get to a common destination, or maybe forgetting tasks or steps in a task, like following a recipe or getting dressed. Time confusion, right? Flip-flopping your days and nights, or not remembering what day it is or what year it is. And then social withdrawal. You can imagine for somebody who is experiencing something like mild cognitive impairment or the early stages of dementia, there may be a level of shame or embarrassment or pride. If they can't always find their words, they're going to find that conversations are hard. And that can be really tricky. So the key, if you are supporting somebody with a type of dementia or mild cognitive impairment, it's key to become empathetic, right? Imagine what they're feeling. And that could be shame and embarrassment in some cases. So that's why we see that withdrawal. There are also things called pseudo-dementia. Has anyone ever heard of pseudo-dementia? So one of the biggest examples of a pseudo-dementia is a UTI. As we age, for whatever reason, when we get a UTI, that level of infection affects our brains in a way that can resemble signs and symptoms of dementia. So sometimes for our residents, it comes on quickly, and we realize, wow, they're not speaking the same, they can't find their words, what's going on? One of the first things that we'll do is test for a UTI. So that's a pseudo-dementia. It could also be stress or medications or a life change, like moving. Those can all trigger some of those signs and symptoms that aren't necessarily dementia. It is key to have early professional evaluation. So again, when you're in your doctor's office, if you're noticing some of these red flags, see it more like the sooner you let somebody know, the sooner you get support. Again, it can be difficult because no one really wants to talk about how they're struggling with their thinking. But it's key in looping in your doctor so we can start getting scans or assessments or have conversations, okay? And then wellness programs, things like coming here today, that's helping your brain health. How about exercise? Does anyone exercise every single day? Yeah, what do you do?
Pilates.
Pilates?
Another workout with weights.
Weights? Okay, how about walking? Where are my walkers? Oh, that's one of the best things you can do, especially now that it's nice. So again, keeping your wellness programs and intentions routine are also going to be helpful. Okay, so I talked about assessment tools. We use two of those here on campus. One of them is called the SLUMS. It's the St. Louis University Mental Status Exam. It is non-diagnostic. So we try to do this for all of our residents, especially when they move in or shortly after they move in, so we can capture a baseline. Again, it's not to have our thumb on you or to criticize you at all. It's really for us to know, okay, so this is what you've scored. It's normal brain aging. Let's do this every year and just make sure that we're keeping track of your baseline. And when we do this, we can give you a copy. You take it to your physician and say, look, I did an assessment. This is where my cognition is now. What do you think? Should we be doing more? Or is this okay for now? Okay, so it's that starting point. Now the SLUMS really only captures those early stages up to mild cognitive impairment. If you do get a diagnosis of dementia and you're more in those mid to later stages, that's when we do the DBAT. So that's the Dementia Behavioral Assessment Tool. And here at Wesley Willows, we adopt the DBAT in its statement of 7 stages of dementia. You may have heard 3, you may have heard 5. Here at Wesley Willows, we identify with 7 stages, okay? So the DBET is more observational. We don't interview you. We really look at how you're going about your day and where that might place you on a stage. And that tells us how to better support you. This is one of my favorite slides that Aileen gave to us. We all deserve a life with the healthiest brain possible. We can all take actions to help protect our brain health. And one of my favorite quotes is, "The world deserves all kinds of minds." Now, one thing I want us to recognize in this room, whether we have dementia or not, or cognitive impairment or not, we all think differently. We perceive differently. We have different personalities. And that's what you call neurodiversity, right? And with neurodiversity comes neuroinclusion, okay? We have to accept the fact that we are all different in how we think, dementia or not, okay? And I love that this says that. Oh, this is the part where we improvise. All right. Oh, it's hopeful. What's the title of the slide?
It's a connection between physical health and brain.
All right, I am going to improvise. You ready for this?
All right.
So the next slide, if you can imagine it, talks about the connection between physical health and brain health. So all my folks in the audience here who exercise, keep doing that. What's one good thing for heart health? Exercise. What's one good thing for brain health? Exercise. Yes. You can have a cookie as long as you promise me a walk. So our bodies were built to move. We were built to be doing things, right? If we think evolutionarily, we were made to go about our day and not be stagnant. So if we choose stagnancy, or if we are in a place where we have to be more stagnant, it's going to affect our brains. So keep up with the exercise. I know Aileen mentioned vascular dementia. For those of you who are familiar with that or not familiar with that, vascular dementia can come about after you've had a stroke, or after you've had a TIA, which is a mini stroke, or if you have poor circulation and that blood is not quite getting to the brain enough. Okay, it's going to cause changes in how you think. So the more you can move, the more you're improving your circulation and the blood flow to your brain, and decreasing your risk for even vascular dementia. Make sense? Who's going to exercise today? There you go. All right, let me see what the next slide is. Okay, so now we're going to talk about activities that boost brain health. Do you all have that calendar in your hands? Okay, awesome. So this is, like I said, today is your starting line for improving your brain health. Step number one, you showed up here, right? You're learning something new and you're socializing. Step number two, you learned the 3 components of brain health: exercise, Mediterranean diet, and socializing. And now these here are going to give you little tips each month on how you can keep filling your bucket, not only for brain health, but for well-being. Okay?
So this clinical trial went on for about 2 years, and what ended up happening was great, because it proved all of the things that Wesley is talking about when it comes to things that we can do to take care of our brain. So it looked at 4 different components: physical exercise, cognitive exercise, nutrition, and also throwing in monitoring our numbers, like our blood pressure, our cholesterol, our glucose, because there's sometimes a link between diabetes and cognitive decline too. So regular check-ins with the doctors throughout these 2-year studies, and it ended up proving that all of these components are something that can work to improve our brain health. So this showed a program combining exercise, nutrition, cognitive engagement, and monitoring our health can meaningfully protect brain health. And participants were put into either a self-guided or structured lifestyle program. And it turns out that the structured group showed the greatest benefit. They performed at cognitive levels comparable to people 2 years younger. So that's always a great sign. So this was a really important study that underscores the message that healthy behaviors can have a powerful impact on our brain health. And so what we did is we came up with what we call our brain health recipe. And that includes a balanced exercise routine that includes 30 to 35 minutes of exercise, things like jogging, walking, dancing even, and anything to get your heart pumping. What doctors will tell you is that we need to get 20 to 25% of the blood that comes through our heart needs to go up to our brain to feed it. And that, including, oxygen, is good for our brain. So we need to exercise to get that blood pumping. Having our blood pressure, our blood sugars, and our weight regularly checked by our healthcare provider, following the MIND diet, and as you mentioned, that includes the dark green vegetables, the berries, the nuts, whole grains, olive oil instead of butter. Most of us have used butter our entire lives, and we want to switch over to olive oil instead. Limiting sugar and unhealthy fats and processed foods. And then regularly exercising and challenging our brain in different ways. So that's basically the outcomes of that pointer study. So take that flyer home with you and see how we can incorporate those changes into our day.
I have a question.
Question, yes.
I thought it was interesting that the rate of Alzheimer's appeared to be doubling every 2 years. Does anybody know why?
So why is the rate of Alzheimer's nearly doubling between 2023 and 2030 versus 2002 and 2023, right? That's a great question. I know Aileen mentioned before the baby boomer generation. So what we know about the baby boomer generation is it's a large population of people. So with that large population of people who are all aging at the same time, that's going to influence those numbers considerably. And then we think about what are the patterns and behaviors of that generation. Typically, fast food, yep. So there's a lot of characteristics of that population that are different from the generation before. A lot more people were working office jobs or sedentary jobs, so we get less exercise. So we see a lot of people, maybe they don't have access to healthcare like the generation before. So we see a lot of people with earlier cognitive decline. And not only are they all aging at the same time, but like Aileen said, we're all living longer too. So we're seeing changes in the brain that we didn't otherwise when our life expectancy was 60 or 75, right? Does that help answer your question? Okay, yes.
There was one of the slides said that Alzheimer's kills more people than prostate cancer and breast cancer. How does it kill people? I'm not familiar with that.
So the question is, how does Alzheimer's kill, right? In the slide with all the statistics, how does it kill more than breast cancer and prostate cancer combined?
So many times there is a comorbidity, which would be like a heart condition, something like that. But basically what happens at the end of someone's life that is experiencing Alzheimer's is they lose their ability to swallow. So that is what ends up.
I have a question in regards to that. It's in the list of dimensions. So what exactly is Alzheimer's and how do you discover it?
Okay, so the question
How
is,
is it diagnosed?
sure, what is Alzheimer's and how is it diagnosed? So Alzheimer's, there's some scientific things that are happening. Basically what happens is we all have proteins that are circulating throughout our bodies. And what happens in the brain is that those proteins will clump up and these tangles form. They're called tau, a lot of medical terms. But what happens is those twist around the brain cells and actually kill the brain cells. So, many times, years and years ago, they could not diagnose Alzheimer's or dementia without doing an autopsy at the end of someone's life. Now, what doctors will look at is what behaviors are you having, what, changes in your cognition are you having. They try to diagnose according to those things, what type of dementia you have. Now they've come out with blood tests that can diagnose Alzheimer's. It's only meant for those early stages kind of a thing. You have to kind of do it at the right time. But they are diagnosing also with a PET scan, so they can actually see the changes in the brain through the PET scan. Cerebral spinal fluid is also another test. So, what they are talking about is possibly doing, more of the testing at our wellness exams to kind of, work through that. And it's a way to catch things early and, be able to diagnose it a little bit earlier too.
But most of the medications don't really work.
Some medications really address the symptoms. So agitation, anxiety, things like that. Back about 2 years ago, we came out with an IV infusion treatment that was approved by the FDA, called Leqembi, and it is meant for the early stages. So that's another reason why we want to make sure people are getting diagnosed early, because they're the ones that are eligible for that IV infusion treatment, and that is looking to signs of slowing the progression of the disease. Not curing.
What about, looking out for people today, what the young people are doing, and all ages, they're not reading anything. All they're doing is looking at the TV, or they walk down the street, and they not over it because they're reading all this stuff from the computer and everything.
Sure.
Is that a problem?
Well, time will tell, right? But I think that what we're trying to do is really bring this out into the community as a whole. I do presentations also for younger people too on ways to take care of their brains, because this is a topic for everybody, right? We need to all be taking care of our brains at all ages.
More question. As far as the numbers of people living with Alzheimer's going up so quickly, could some of that be that it's being diagnosed more and earlier?
Sure, and that is very true. The numbers of people being diagnosed with Alzheimer's is growing because people are being diagnosed, and that is, there's more concentration on it. We look at those who have a higher risk. Our Black Americans are twice as likely to develop Alzheimer's, and Hispanic Americans are 1.5 times as likely. And we look at maybe some lack of health care and diet being associated with that. So the more people are seeing their healthcare providers and being proactive in their healthcare is the way to do it. So, yeah.
Do you find that a lot of the habits that we acquired as young people are surfacing now?
The different habits that we had. Well, and I think what Leslie had mentioned too about, keeping that active lifestyle, that's the important thing. Were there some sedentary lifestyles that have come back to cause some of these things? That's what we're seeing.
More in the line of cooking and activity.
Sure. Well, going back to that, all of the healthy year eating, the exercising is going to help.
So maybe let's hold the questions.
It's our medical society. I talked to my doctor about it, and she gave me this little test about, she lives in Chicago, and, well, she didn't seem to take, I thought we were supposed to get a neurological test.
Sure. So the medical testing that the doctor would do at your wellness exam is really just a mini test. If you're wanting to get a more advanced test, you would probably want to see a neurologist. So we're going to hold some questions for now and try to get back to those. We'll answer yours in the back after we're done.
All right, I love the Q&A, so please do hold on to your questions. we're getting through. So as Melissa mentioned, this 12-month brain health calendar is for you. If you need a copy or you want to share that with anybody that you know and love, you can reach out to us. We can get you an electronic version of that. And I'm going to hand it over to Melissa for a little bit, just to talk through how Wesley Willows supports you in your brain health and well-being. And then we'll wrap it up for questions.
One of the reasons that we talk about these things is also because of the way that Peterson Meadows and Wesley Willows and Highview in the Woodlands supports people through activities, through brain health and well-being. Today we did a great activity, a pump it for Parkinson's. That's great exercise. I know, yeah, give Liz a round of applause. She put all that together. It's hard work. So we made our goal. Yep. So, you know, certainly for those of you who don't live at one of our communities, we want to just really drive home that living at one of our communities gives you access to resources and to well-being activities that can support you wherever you're at in your cognitive journey. We really try to personalize those activities, and I know that Leslie takes the time out to meet with residents and talk through different courses of action that they can take, or areas that they might need to beef up a little bit. Maybe one person, they work puzzles all day long and they do brain games and things like that, but they rarely exercise. Leslie and her team work with people to identify those areas that they can improve. Certainly socially, I think that we have wonderful, wonderful community here. It is a neighborhood, neighbors become friends, and it helps you socially to not be isolated and make new friends. And certainly peace of mind, just to have a lifestyle that you're in, to have the resources that you need, and to know that wonderful staff like Leslie and Joe and Ryan and Liz, some days me, are here for you.